Hi, I'm Dr. James Amos. I'm a staff psychiatrist at University Hospital in Iowa City, and this is yet another Dirty Dozen presentation, this time using selected material from a book written by Dr. Alan Francis, MD, entitled Essentials of Psychiatric Diagnosis. This is the book, and I did obtain permission to use this material, and the material in this presentation is taken from the book Essentials of Psychiatric Diagnosis, Responding to the Challenge of DSM-5, written by Dr. Alan Francis, MD, and published by the Guilford Press, and is reprinted with permission from the Guilford Press, who is the copyright holder, to use the selection A Dozen General Tips from Chapter 1, pages 14 through 15, and incorporate it into a YouTube video. The chapter really is about how to approach the process of psychiatric diagnosis, which is carefully. And I'll be following along with the slides here in front of me. The dozen general tips start with tip number 1. And I'll be reading what the tip is and then expanding briefly about my impression of them. Tip 1 is Hippocrates said that knowing the patient is just as important as knowing the disease. People are not just collections of signs and symptoms. And there is a link to a thought-provoking article about Dr. Francis W. Peabody, who said, "For the secret of the care of the patient is in caring for the patient." Tip number 2 is take the time and make the effort. This is about spending time with the patient, and that can make all the difference. Often what I try to do is to find a chair and sit down when I enter the room. It helps to make the patient more comfortable and sets the stage for careful listening by the physician. There's a link on this slide to a video which can be found at the Arnold P. Gold Foundation, and they're all about humanism in medicine. Tip number 3, if you hear hoofbeats on Broadway, think horses, not zebras. Context is very important in psychiatric evaluations. In the setting of severe medical illness, polypharmacy, advanced age, delusions, and hallucinations probably are more likely to mean delirium rather than new onset psychosis. While this is common sense, it's often true that common sense is not used commonly. Tip number 4, get all the information you can. It's often helpful to get information from others as well as the patient, and to listen to their impressions as well as the factual information you obtain, without judging them. Tip number 5, consider previous diagnoses, but don't blindly believe them. Flexibility is a habit which can be nurtured, and skepticism can be a virtue. Tip number 6, constantly revisit the diagnosis. It's really okay to withhold judgment and change an opinion when new information is available. Getting to know patients can mean learning something new each time you see them. Tip number 7, children and teenagers are especially hard to diagnose. I've never been a child, but my colleagues and friends tell me that childhood is a time of rapid and reactive change, physically, emotionally, and spiritually. Tip number 8, the elderly are also hard to diagnose. The risk for delirium and dementia in this population are elevated. Both of these situations can present with symptoms that mimic primary psychiatric disorders. And the elderly may be taking medications that influence affect, behavior, and cognition. Tip number 9, the less severe the presentation, the more difficult it is to diagnose. Symptoms are not the same thing as suffering, and for every clinician, intensity and impairment can be important clues to use when deciding when and how to help. Tip number 10. When you are in doubt, it is safer and more accurate to underdiagnose. That's because psychiatric labels tend to be sticky. Tip number 11. Accurate diagnosis can bring great benefits. Inaccurate diagnosis can bring disaster. The consequences of mislabeling people can lead to medical, social, and financial adversities, which are difficult sometimes for doctors to see happen to their patients. Tip number 12, the last one. Always remember the other enduring dictum from Hippocrates: first, do no harm. Well, thanks for listening to the Dirty Dozen General Tips about Psychiatric Diagnosis, authored by Dr. Alan Francis in his book Essential Psychiatric Diagnosis, and I thank Dr. Francis and the Guilford Press for giving me permission kindly to use them in this Dirty Dozen presentation.